Hello everybody and welcome to PathoLogic. Today we will be discussing hyperthyroidism in our veterinary species. Hyperthyroidism is the most common endocrine disease in older cats over 7 years of age. However, other species can also develop this disorder. It typically results from a functional tumor of the thyroid gland. These functional tumors produce a large amount of thyroid hormone. In cats, most of these tumors are benign adenomas, whereas in dogs, they are most commonly carcinomas. The classic picture of a hyperthyroid cat is a skinny, very hungry, irritable senior cat. They may also have a palpably enlarged thyroid gland, sometimes called a thyroid slip because you can slip the gland between your fingers as you palpate. Some cats also develop hypertension and tachycardia due to their hyperthyroidism. Most of the clinical signs associated with hyperthyroidism are directly due to the elevated thyroid hormone. This increases metabolic rate, resulting in several different outcomes. Higher metabolism results in muscle and fat breakdown, thus causing weight loss. The combination of weight loss and elevated metabolism can also trigger hunger, resulting in a compensatory polyphagia. Finally, thyroid hormone decreases systemic vascular resistance, increases heart rate, and raises cardiac output. This results in the hypertension and tachycardia seen in some animals. There are a couple of important consequences of hyperthyroidism to look out for. The first is thyrotoxic heart disease. Thyroid hormone has direct stimulatory effects on the cardiac muscle. This typically induces a reversible hypertrophic cardiomyopathy. You may also see arrhythmias and murmurs in these patients due to cardiac disease. Hypertension due to hyperthyroidism can also cause hypertensive retinopathy. The retina contains numerous small blood vessels that are not able to sustain a high blood pressure. This results in fluid leaking from those vessels, and that fluid accumulates behind the retina, causing it to detach and eventually causing blindness for the animal. Hyperthyroidism can also cause insulin resistance. This is because thyroid hormone can increase insulin secretion, leading to reduced responses by the peripheral tissues, and it can also increase glucose absorption from the intestine as well as production by the liver, leading to hyperglycemia. These factors may lead to or contribute to diabetes in the patient. One study showed that around 3% of cats with diabetes also had concurrent hyperthyroidism. For these patients, treating their hyperthyroidism will help get their diabetes under better control. Finally, we have chronic kidney disease. This is not actually a consequence of hyperthyroidism. However, it often appears once patients begin treatment for their hyperthyroidism. This is because elevated thyroid hormone increases glomerular filtration rate, which maximizes creatinine and urea excretion. This can bring these waste products down to normal levels, despite the kidneys not actually functioning optimally. Once hyperthyroidism treatment begins, glomerular filtration rate returns to normal levels, and the underlying renal disease now becomes clinical. Now we will look briefly at diagnosing this condition. The primary diagnostic test is total T4. This test reflects the amount of T4 in the bloodstream, including the amount that is bound to protein. Bound T4 makes up the majority of the T4 in the blood. If total T4 is high, it indicates hyperthyroidism. If the value is elevated, but still within the normal reference range, there are a couple of things that you might want to consider. The first is euthyroid 6 syndrome, and the second are aging changes in thyroid hormone levels. Euthyroid 6 syndrome is a syndrome where thyroid hormones are low as a consequence of non-thyroidal illness. Conditions that can cause this syndrome include hyperadrenocorticism, diabetes, liver disease, renal disease, etc. It is thought that this syndrome develops due to cytokines, inflammatory mediators, or high serum cortisol inhibiting the deiodinase enzymes that convert T4 into its active form of T3. Therefore, sick hyperthyroid patients may actually have a high normal T4 level if they have another condition that is causing euthyroid sick syndrome. T4 concentrations can also decrease naturally with age. This essentially lowers the upper end of the reference interval for older animals compared to their younger peers. Therefore, senior and geriatric cats may show signs of hyperthyroidism despite only having a high normal T4 result. These animals should still be treated as if they are hyperthyroid. For cases where total T4 status is ambiguous, free T4 can be used as a confirmatory test. This test measures the T4 in the blood that is not bound to protein, which is more consistently elevated in hyperthyroidism. It is important to know that this test should not be used on its own, as it has a poor specificity with many false positives when used as a sole test. Here is a flowchart giving an overview of how to use total and free T4. Basically, a free T4 should be ordered when you have a patient with a high normal T4 and potential signs of hyperthyroidism. If free T4 is high, then the patient likely has hyperthyroidism. If it is normal, then the patient is likely euthyroid or has normal thyroid function. So to summarize, hyperthyroidism is most common in senior cats of our veterinary species. The disease typically results from a functional adenoma in cats and carcinomas in dogs. The classic signs are weight loss, polyphagia, and a palpable thyroid gland or thyroid slip. For diagnosis, look at total and free T4 values. And finally, be aware that treating hyperthyroidism can uncover underlying renal disease. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. Thanks again for watching, and we will see you in the next video.